Hello and welcome to the award-winning Waterman Wellness. Your pathway to health and wellness with local experts is your guides. I'm Alyssa Hritzik. We have a lot of health and wellness news for you in this episode, including Lake County surgeons are touting a robotic-assisted procedure that helps patients suffering from hip pain. A local hospital is celebrating a new and historic milestone. You'll find out why this is important to the community. Stay tuned. And prostate cancer patients are benefiting from a state-of-the-art procedure that helps prevent side effects from radiation treatment. We begin with the story of a Mount Dora man who credits his local community hospital with saving his life after a potentially deadly heart condition. James Gibby had been experiencing fatigue and shortness of breath for 3 days before he finally sought medical attention.
They found 3 arteries that were blocked, 100% and 170%. I never had any symptoms that would indicate a heart blockage, much less one of the severity that I was told that I had. I have always been very optimistic and an energized person. My wife and I are very active in the sports and the things that we do. So no, there was no real indications to tell me that I had an impending crisis.
Florida Hospital Waterman cardiothoracic surgeon Gary Allen performed a coronary artery bypass grafting procedure to improve blood flow to Mr. Gibby's heart.
I was up and walking as quickly as they could get me moving. So they did want me to, even during the day, I did not want to lay in the bed.
Mr. Gibby was discharged after 10 days and was able to go home, but with some help.
After about 3 or 4 days, the home care nursing started to arrive, and they would usually come about twice a week, and they're very, very pleasant people. They had a specific task to perform to check my vitals and to be sure that verbally I was responsive and that I was on the road to recovery. The primary thing that I would want to say to anyone else is, if you have an issue, deal with it. Don't ignore it. Call your doctor, get to the hospital. If it's a false alarm, that's fine. If it's not a false alarm, then you will be in the best hands possible.
Dr. Allen says Florida Hospital Waterman has invested heavily in its cardiac program to be able to treat a wide variety of heart conditions.
But now that we are in soon to be our 9th year and are getting pretty close to doing our 2000th operation here, the evolution of the program is such, and the proof is in the pudding, as we say, that we're able to perform operations, at the highest level, whether it is aortic dissections, other really interesting stuff that we do that's unusual at a community level. And we've had several really good saves and good experiences, here in Lake County, where if you would have asked someone 5 or 10 years ago, they would have thought, well, that was an impossibility, but now it becomes, almost commonplace.
Learn more about the advanced cardiac services at Florida Hospital Waterman by visiting fhwatermanheart.com. The Tavares Community Hospital is also the only one in Lake County that has invested in another advanced treatment to serve the area's changing population.
We as intensivists have had problems with patients with ARDS, adult respiratory distress syndrome, caused by severe pneumonia, fluid overload, viruses, various other things. We really struggled because when you injure another part of your body, say I injure my leg, I let my leg rest. I put it up, I put ice on it. If your lungs get injured and they have an inflammatory process, the reality is we can't let them rest because we need them to oxygenate you. So anybody who has a severe lung injury can go on ECMO to allow their lungs to rest. So ECMO, or extracorporeal membrane oxygenation, is the ability to allow us to actually oxygenate the patient without actually utilizing their lungs. It's pretty amazing when you think about it, that for the first time now we can let your lungs rest while we're actually oxygenating you.
Michael Riley of Grand Island recalls coming to the Florida Hospital Waterman Emergency Department with severe symptoms that rapidly deteriorated.
Having the flu symptoms, hot chills, fever of 103. I was in the hospital for, I'd say like 4 days before they put me in a coma.
Dr. Guzzi says Riley was put into an induced coma so the ECMO machine could give his lungs a chance to recover from severe pneumonia.
During the run of a patient on ECMO, nursing is one-on-one in CVICU. Respiratory therapy is there taking care of the ventilator, and the person that is running the ECMO pump or the machine itself, the bedside machine, is our perfusionist. And they are especially highly trained in the care of these patients. They oversee all the medication processes, their labs, making sure the flows are correct, everything that that patient needs. Nobody ever leaves that room. That patient is never left uncared for.
Mr. Riley was in the induced coma for 40 days.
I don't really remember quite so much till after I started looking at pictures on my phone and, seeing pictures of me and how swollen my eyes were and how sick I looked. So I took pictures of myself when I was in the hospital, doing little selfies. For what I remember, they did awesome. I actually did come up and visit the ICU unit. They were all crying, and a lot of people died at the beginning of this year with the flu that I had. So luckily the ECMO was here and kept me pumping.
With flu season upon us, visit fhwatermaner.com to learn about the critical care resources here in Lake County. Our next story is for the guys and involves a new procedure that helps patients being treated for prostate cancer. While extremely effective in reducing or eliminating cancer cells, radiation therapy may cause side effects for patients.
Patients can experience some fatigue, some problems with urinary function, sometimes problem with rectal function, and men can also experience sexual side effects as well. The Space OAR is a water-based gel that's placed between the prostate and rectum. What that effectively does is push the rectum just a short distance away from the prostate, which allows to spare it from the majority of the radiation that's delivered to the prostate gland. With the Space OAR, we've seen much less rectal side effects from radiation therapy. So the Space OAR is generally done before the radiation treatment starts. There's a needle placed through the skin in the perineum under ultrasound guidance. That procedure can be done in the office with sedation, or if patients choose, they can be done under general anesthesia in the operating room as well. During the time the Space OAR is in place, patients generally don't feel it and have very little side effects associated with it. It's water-based, so it dissolves in about 6 months and your body will get rid of it the way it does any normal fluid. Almost all prostate cancer patients can receive Space OAR and benefit from it. This is the state-of-the-art technology that's close to home, and so patients locally don't have to travel. Often for radiation therapy, there's multiple visits involved, so having a facility close to home is a great service to our patients.
Florida Hospital Waterman is the only facility offering the Space OAR procedure in Lake County. A former Miss Florida recently shared her story about battling cancer in our next story. Kristen Bell Ludicky was the keynote speaker at the 5th annual Ladies Legacy Luncheon held at Lake Receptions. Ludicky told the audience about her experiences as a pageant winner, building contractor, and cancer survivor.
It's been an interesting process for me because this is the first time that I've spoken on my cancer journey. It's really important in today's day and age to know your genetics. Genetic testing saved my life. And having that knowledge ahead of time and being acutely aware of what my predispositions were, I think is so very important. And that's an important message.
And it's such a big event, it's growing every year. I had so much to offer to the committee, and I was actually honored when they asked us to be part of it. It's very special to us to be able to celebrate the surviving and supporting the community.
Nearly 400 people attended the event, which raised money for Florida Hospital Waterman Cancer Care Services. You can learn more about advanced cancer treatments and resources for women and men by visiting fhwatermancancer.com. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. He's walking without pain, thanks to a Lake County orthopedic surgeon who gets assistance from a robot. We'll explain. A Lake County mainstay will get a new look just as it celebrates an 80-year milestone. And we'll have a delicious recipe for a holiday side dish or appetizer when we visit the Conry Creation Health Center kitchen. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. You might want to check out these upcoming community events. Don't go away. Waterman Wellness will be right back.
It's time for the Creation Health Tip of the Month. Many people do not know their health risks until it's too late. Today, take responsibility for your well-being and commit to getting a yearly physical.
Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Alyssa Hritzik. We've got a bit of a history lesson for you, and it's tied in with history in the making. A Lake County icon is approaching its 80th anniversary, at the same time that it's getting a new brand. In 1938, Frank Waterman turned his downtown Eustis Fountain Inn over to a group of doctors to use as a hospital. It became known as Waterman Memorial Hospital. Over the years, the community hospital has changed names, locations, and expanded in size and scope of services. Today, Florida Hospital Waterman, located in Tavares, is preparing for a new name and brand.
So the official transition to our name will occur January 2nd. And until then, however, there will be a lot of communication with our community through various means of media that would say becoming, we are becoming Advent Health, and then starting January 2nd, it would be we are Advent Health. Well, Advent Health represents the coming of something new. And for me, what that means is an opportunity to really create for our community a sense of our transition to this coordinated care that's promising wholeness. And that is something new, but it's building on the foundation we already have. And nothing gives me more pride than watching our teams connect with what's happening. It is sacred work that they do. They bring their heart and intellect into it, and I want to remind them and thank them for that great work, because they are the ones that will essentially propel this forward. Otherwise, it becomes just a name change. It really is a cultural transformation, which they are fully embracing and living.
You can learn more about the transformation to Advent Health Waterman by visiting the website on your screen. Next, a Villages man is enjoying his favorite hobby again after a hip procedure, and his surgeon was assisted by a robot.
It was starting to cause a lot of pain to the hip and the groin area, and it became debilitating where I couldn't get around comfortably.
Crowdis makes area rugs, and the hours of standing became unbearable. He sought help from orthopedic surgeon John Radnothy, who suggested Makoplasty robot hip replacement surgery after therapy and medication didn't help.
I think with the Makoplasty robot, it's just a little bit more consistent, we're a little bit more precise, a little bit less sacrifice of normal bone and normal tissue, and just getting right to the pathology and being able to address that and not really damage any of the other tissue, and do it in a way that ensures us to have good leg lengths, good, proper, consistent orientation of the implants.
2 days after the surgery, Crowdis walked out of the hospital.
I was basically in no actual pain, a little bit happy, but real bad pain, no, never was. And I went home from the hospital after 2 days, and I never did fill my Percocet prescription. I took Tylenol and walked through it.
We've learned the best way to do it compared to just a better way to do it. And I think that is reflected in the results of people. When people come in for their 2-week office visit and their range of motion is better than mine is right now after 2 weeks, and they're not having any pain or very little pain.
The orthopedic surgeons at Florida Hospital Waterman have more experience with Mako-assisted surgery than any other hospital in Central Florida. You can learn more about the Mako robotic arm procedures by visiting the website fhwatermanortho.com. Next, Waterman Wellness has some assistance for pulling off a delicious holiday dinner. We visit the Conway Creation Health Center kitchen, where Jenna Krager and the team has a sweet potato recipe your guests will love.
During the holidays, we're faced with an abundance of rich foods, but we know eating too much isn't good for our health. So today we're joined by Florida Hospital Waterman Executive Chef Jason Boulay and Registered Dietitian Mara Gallo, and they're going to teach us an easy to make and delicious side dish that our friends and family won't even believe is healthy. What are we making today?
Today we're making sweet potato puffs made with just some sweet potatoes, some orange juice to sweeten them. It's a nice light recipe and individual portion size.
All right, so Chef, tell us what we're making today and how we put it together.
Well, this is a really simple recipe. It only has about 6 ingredients and it can be made pretty quickly. All you need is some sweet potatoes, some orange juice, some orange zest, eggs, and some nutmeg. So this is a real easy dish that we can make even from leftover sweet potatoes from a holiday meal, or we can just cook them fresh right before we're ready to serve. And all you really want to do is just get them into some nice boiling water, about 1-inch cubes for about 15 minutes. You want them to be soft so that way they can be mixed up nice and smooth. Okay, so we're just going to start mashing some of these potatoes up. So now that we got our potatoes going here, we can add in our orange zest, our nutmeg, our orange juice. The sugar that's in the juice with the potato itself is just going to make this real nice and sweet, and then it's also going to help caramelize it when it gets baked off into the oven. Now that we got everything mashed up and everything smooth, I'm going to go ahead and add in our egg. Okay, so now once you have all the egg completely incorporated, you want to kind of scoop these into probably 10 to 12 maybe similar size bites here.
Sweet potatoes are high in vitamin A, which is good for our eye health. They're also good, they're nice and high in fiber, so it's going to help keep you full.
I love sweet potatoes.
Okay, so now once we have these scooped out onto our pan, we're just going to go ahead and give them a little bit of a sprinkle with some pecans. Once we have these all set, we're going to go ahead and place them into a 375-degree oven for just about 15 minutes. And you don't want to be too scared to cook them for too long. You want to make sure that they get a nice caramelization on there. It's what's going to help kind of give them a little bit of crunch, and it's going to kind of give them some good texture to them.
This looks like something you could serve as an appetizer too.
Definitely.
Just pick up and eat.
And there we go.
Okay.
Thank you.
That's great.
Very good.
You can really taste the citrus in there.
It is nice and refreshing.
Thank you, Chef.
You're very welcome.
You'll find the recipe for the sweet potato puffs by visiting watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for us next time right here on Lake Sumter TV. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Melissa Hritzik for the award-winning Waterman Wellness.